when they're above the muscle, they see their final results sooner. There's less swelling, there's less settling in. The whole drop and fluff phenomenon doesn't really happen when you're above the muscle. When you're under the muscle, that does happen. Well, it's the way the breast looks. It's a little bit more complicated to know exactly what's happening inside the breast, but many times, especially when the breast implants are under the muscle, there's a lot of swelling and fullness in the upper pole of the breast. That is, from the nipple up. Things are a little fuller than would look natural. Sometimes patients like all of that fullness, but the lower part of their breast is somewhat underfilled as the implant looks like it's sitting too high. And then as that swelling goes down, and then the skin between the nipple and the fold, that is the lower part of the breast, that skin starts to stretch, and then the implant settles into its final pocket and looks more natural. It usually gets softer at the same time, sometimes more comfortable as the swelling goes down, and that's the drop and fluff phenomenon. So I say above the muscle, you're definitely seeing your final results when you're 3 months out. When it's under the muscle, probably have to add a couple of months to that. You're probably seeing your final result at 4 to 6 months. And then again, by the end of the year, maybe just another 10% of settling happens. Everybody's really settled in by a year. And it's hard to believe that it takes that long, but it's a subtle thing. After those first few months, it's a subtle settling and softening of the implants up to about a year. And I tell my patients, don't buy too many bras until that has all happened, because they're just not going to fit right. If you buy your bras too soon and then the dropping and the fluffing happens, then they just might not fit the way they did before. So